Thank you, Michael, and thank you all for allowing me to come and chat with you briefly. I am incredibly privileged to work at this incredible institution, and I've been at other children's hospitals, other big children's hospitals, and we were talking before lunch during cocktails. We were talking before lunch that this place really is different, and it's my remarkable privilege to be able to work here. And much of that is due to what you all do for us, because we can't do everything. And it is a you think, well, it's the intestine. The intestine is an incredibly complicated organ. It has lots of different cell types, and the importance of that is multifold. First of all, we have a number of patients, typically they're babies, who lose most of their intestine because of disease that they suffer because of prematurity. Now we have the potential that we can engineer their own intestine back, right? So not transplanting somebody else's intestine, which has all the problems with transplant, but actually giving them their own intestine back. Equally importantly, they've discovered that if you take cells from a patient who has an intestinal disorder and you create this new intestine, it has the same disorder that the patient had with their intestine, which then gives us an incredible model for studying that disease in mice. You can grow this intestine in mice, human intestine in the mouse, planting fetuses in utero before they're born, so that you could cure sickle cell disease. By the time the child's born, it's already been treated and fixed. They're working on how to treat other things like diaphragmatic hernia and other mechanical problems, spina bifida and myelomeningocele, using minimally invasive techniques. If they bring slides, and I just bring these slides, so don't worry, I'm not going to show them. It's great. You can do what's called scaling, so that I can set the robot so that when if I move my hand an inch, the robot arm moves a centimeter. And so you can end up doing things in a very, very precise manner, because I can make big giant movements and they're translated into very, very fine, tiny movements. It's even been talked about, you can set the robot up so that it will actually move in a regular rhythm, so that you could potentially operate on the heart while it's still beating, but when you're looking at it, it would look like it was just standing still, because the robot's moving back and forth as the heart beats. So some of these things we've realized, the scaling, the tremor filtration, all that, some things we have yet to realize. And my hope is that as we continue to have this technology evolve, we'll be able to take that business I talked about first with the very sophisticated radiology techniques we have to create what people have referred to as augmented reality, where we get an MRI scan on a patient who has a liver tumor, very precisely defines within the liver where that tumor exists. Yet when I go to the operating room, I can only look at the outside of the liver, and as we work through it, you have to use other methods to try to make sure you're taking out all of the tumor, for example. Whereas the hope is that at some point we're going to be able to take that preoperative MRI and merge it with what we're looking at visually, so that I can essentially see the MRI in the moving patient, and then I'll know if the next bite with the scissors is going to be through a really big blood vessel, and I can do something about that before I do it. You could even potentially set it up so the robot would not allow you to go in places where you might do something bad. So there's huge potential for this technology. It's not there yet, but it is remarkable how fast it has developed and how many opportunities there are for it to continue to develop. What I would like to offer is, we are very fortunate, again, thanks to you all for much of your support. Not only do we have a Da Vinci here, but we have the most sophisticated Da Vinci robot that the company makes. It's important for several reasons. It's important because it's smaller than the previous ones. And the smallest patient I've ever done a robot case on was 5 kilos, so about 10 pounds. And the anesthesiologists were going crazy because they couldn't even see the patient because he was completely covered by the robot. And now the bedside cart is dramatically smaller. That allows us to work with the instruments closer together, and it also gives the anesthesiologist much better access to the patient, so much safer. It's being used extensively by our urologists, endoscopic surgery, but it's hard to appreciate that until you actually sit down and try it. So with that, again, I would thank you for all that you do for us, the fortunate people that get to work here and take care of patients, and I hope that you all take some measure of pride and satisfaction from helping to get kids better, because it is the most satisfying job in the whole world. So thank you.
Yes, how are you? Good. Like you said, you're 5 minutes away.